Dr. Stephen Mulholland is here, founder of Spa Medica, one of Canada's top cosmetic surgeons. Welcome back to the show.
Oh, well, thank you for having me again, Barb. Of course, in the summer, we're all working on our sun damage.
That's right. We have to get that sun damage going so that you have a lot of business in the fall.
Yeah, I'm a big fan of sun damage. We can treat it. It's just wear enough sunblocks you don't get a skin cancer. That's the main thing.
So I was saying that you look great. You don't have to tell us anything about what, but you're sort of looking after. I mean, you've been losing weight and looking good for the last couple of years, but I just noticed you seem to have lost some more weight.
Yeah, I kind of made a commitment when I looked at my youngest kid and I realized, oh my God, my sixth could beat me up, and he was like 11 years old. And so I decided to stop drinking for a number of reasons, mainly just to be sharper and work more effectively. And then after that, I decided to lose weight. And I'm hoping that my wife and I are going to do a Bravo sort of documentary climbing up to the first or second base camp of Everest. So
wow.
I figured I can't be lugging that 185 pounds with me. So I thought I'd lose at least the weight of the pack I'm going to carry, which is 25, 30 pounds.
Now, you, and this was a couple of years ago, and I think you talked about it on when your wife was on Real Housewives, but you gave up alcohol. Did that make a major difference in your weight?
You know, I have to say, I was a social drinker my entire adult life since I was a doctor, to sort of a couple glasses of wine with my wife at dinner. And of course, I would have the 3 glasses, she'd have the 2, and that's about 150 calories every night. Then some mixed drinks on the weekend. I've never missed a day of work, but I was consuming at least 1,500 to 2,000 calories, every 3 or 4 days just with alcohol. And so I didn't like it all that much. I played professional hockey as part of our culture then, but I just decided that if I want to get in shape, I have to make some sacrifices. Alcohol is the easiest one to make.
Mm-hmm. And you feel good too.
I feel better, yeah, absolutely. And then in getting ready for this, shedding my backpack weight, I then just eliminated simple carbohydrates because I was pretty much like a pasta junkie and loved bread. And I just gave that up for just protein and leafy green vegetables. So I see a lot of patients with liposuction. And when I'm talking to them, you'd be best to lose 20 pounds before surgery. I just walk them through what some of the options are. You've got your radical weight loss programs like your Bernstein starvation, 800-calorie diets. Those are not really sustainable. You want to have behavioral change. You want to remove the emotional cues for eating, and then take your basal metabolic rate. You can do this with your doctor, and you have a certain number of calories based on your BMI that you need to sustain your weight, and it's very predictable. It's like a formula. What your basal metabolic rate needs to be, and the calories you need to lose weight. And for me, it was about 1,800 calories a day, which is a doable amount. If you're just having mainly protein and some balanced leafy green vegetables, making sure you have a multivitamin, and you're not, I just don't, I avoid gluten substances, not that I'm sensitive, but they tend to be flour and simple carbohydrates for gluten, and that's it. And
do you ever crave anything?
I did initially, and then once my stomach shrunk, to that size where I'm not a sugar craver, so if you really crave simple sugars, they have products now that are off-label for diabetes called Ozempic, which is blocks a certain receptor in your brain that helps with cravings. So although I'm not a craver, I have many patients who have gone to reputable bariatric physicians, and they put them on this product called Ozempic, and it's an injection once a week, and it takes away the number one reason people fail, which is they can't overcome the craving. They see a simple carb or a candy, and they must have it. And these products, which are Health Canada approved for diabetes, they help control glucagon and some other complex issues within your body. But the main thing is they take away craving. And they give you an ambient sense of what patients report as kind of a sense of nausea when they look at eating foods they used to gorge on. And it's been very, very helpful to have stable, gradual weight loss. So lose the weight over time, change your behavior, gradually institute exercise, because anyone can lose weight. Just go to a Bernstein clinic. It's the rebound weight gain you get after you crash. That's usually what really sinks people's motivation and will to go on.
416-872-1010. Text us at 71010. We had somebody hanging on, and he could not hang on any longer, but he had a question, and we're answering any kind of question I guess people would come to see you for a consultation about,
sure,
right?
Anything from non-surgical to surgical. Weight loss is a good entree into where does liposuction fit, and do we have some non-liposuction technology? We've got some really cool stuff. There's a new technology that for the first time works from the inside out. So it's pulsed high-intensity electromagnetic radiation that results in contraction of your abdominal muscles or your butt muscle or your thigh muscle. And it's like 20,000 supramaximal contractions in 30 minutes. You can't ever replicate that through exercise. And it creates about a 20% hypertrophy in your muscle fiber size and number of your abs or your glutes or your thigh after simply 4 treatments in 2 weeks. And it kills about 18% of the fat over top of that. So that's totally new. We've had Cool Sculpting, we've had Sculpture, we've had all these products. This is very, very new to the North American market.
So this is like fat reduction plus a workout?
Correct, yeah. So you're building tone, you're building up muscle, and you're killing the overlying fat. M-Sculpt is its name. There's going to be a lot of spillover from media in the U.S. and in Canada. It's very, very safe. There's almost no contraindications. There's no thermal heat. It's very comfortable. You get kind of like that lactic acid feeling 2 days later, like you had a really good workout. But that's been very, very popular. Now, you can't be particularly chubby or overweight, so it's not for your bigger BMI patients. They need weight loss, cool sculpting, sculpture. It's for your smaller BMI patients, something like a BMI of 28 to 30, couple of inches over, where your rectus abdominis or your muscle, or, a butt that's a bit saggy and you want to tighten up the muscle and lift the fat. That's who it's good for. So for the very first time, we can now treat from the inside out, from the muscle out to the fat, rather than from the outside in.
Now, I know that when your wife was doing the show and you were on it, and I loved it. I watched it every week. And there was one episode where a number of the housewives took part in a demonstration, and they had something attached to their abdomens.
Yes.
Was that one of these?
That is one of the outside-in products, and that was new then. It shows you how quickly our industry changes. That's called Sculpture, and that's sustained heat that will heat the fat for 25 minutes and kill a significant percent. Or we can do Cool Sculpting, which cools the fat from the outside. Those are what I call the outside-in technologies for fat reduction, but they don't affect your muscle at all. This product puts 2 electromagnetic field paddles over your rectus abdominis, and you get titanic supramaximal contractions. They feel odd. They feel weird. It's not like physiotherapy EMS. These are like, as I say, 20,000 in 30 minutes. You can't replicate them so we get even fairly sculpted bodybuilders come in to get that 20% more muscle fiber they can't get in a gym, and kill whatever fat they have over their muscles. So for that type of patient that's pretty fit, has a little annoying pot after all the workouts, it's a nice way to rehab, enhance, and build your muscle while killing fat.
And 30-minute treatments, and how many treatments do most people need?
It's really just 4 treatments over 2 weeks, and you wait 4 weeks.
Wow.
And it's very quick. Most of our treatments take a long time, other than Botox and injectables, like a package of hair removal, a package of photofacial. This works very, very quickly. Some patients will come back and do another 2-week cycle, but the basic program, where there's well over 90% satisfaction, is just 4 treatments over 2 weeks.
And what kind of difference do people see? I mean, I know you've talked in percentages. Is there a measure in terms of inches?
In general, it's about a centimeter reduction of pinchable fat, and a visible toning and honing of your muscles. So you're killing some of the fat over the muscle. You can see more of your muscle, and the muscles themselves look more toned, more defined, more polished, like you have just finished a 16-week or 4-month bodybuilding cycle to build up your pecs, your arms. Yeah, it's super amazing. This 20,000 contraction in 30 minutes would take you months to replicate. You can't even do that if you're a bodybuilder. So we have many guys who come and say, wow, I've been bodybuilding for 2 years. I can't do this on my own. So it doesn't replace exercise or diet. It's when you've got to a stalled position in your body shaping goals where M-Sculpt takes over.
416-872-1010. Text us at 71010. If you have any questions about any cosmetic procedures you are curious about, maybe you have been thinking about for yourself, or maybe one of your kids or your spouse has come to you and said, I'm thinking about having this done. 416-872-1010. Dr. Stephen Mulholland is here for the hour, and you are listening to The Night Side. Great to have you along on this Thursday evening. Special guest in studio, Dr. Stephen Mulholland. He is the founder of Spa Medica, one of Canada's top cosmetic surgeons, and he's taking your calls and answering all of your questions on anything related to any procedure you might be thinking about having. Maybe it's something sort of on your wish list. You're not sure if you can afford it, or maybe what's right for you in terms of a spot that is bothering you. 416-872-1010. We're going to start with Maria. Welcome to the show.
Hi, how you doing?
Good, thank you. Go ahead with Dr. Mulholland.
Well, what's bothering me right now is my midsection. For the most part, I'm doing very good for over a year. I've been exercising, walking, and doing vegetables and fish and vegetables and meat. And then sometimes that you see those odd, at the socials, like, oh my God, that tastes, I haven't had that in a long time. So you kind of binge a little. But for the most part, I'm doing pretty good. And I do my hour walk at least 4 times a week. And some couple of weeks when you get busy, you miss that too. But I just like to ask you, when I heard you say that you do proteins and veggies, right?
Yeah, that would be the high protein approach. There are some different options. Maria, how much weight have you lost of your target weight?
Honestly, I have a phobia of going on a scale, but
Right.
I know because of a lot of my clothes is very loose on me now. A lot of people are saying, "Oh my God, Maria, you're losing weight, you're doing great."
How much would you guess you've lost?
I would guess 25, 30 pounds.
So that's really good, actually. That's like probably over between 10 and 20% of your total body mass, and that's good. And then what happens is, I've been doing this almost 25 years now. Patients get to a weight where they plateau, but they have a stubborn area, like a little pot below their belly button, or a saddlebag, or an inner thigh, or an upper arm that's very difficult to target with caloric transitioning. So you can't say, okay, I'm going to eat this beautiful healthy diet and I want it to come only off my thighs. It always comes off where you don't want it. And so when you get to a reasonable weight, Maria, like where you're at, this is where sometimes you might meet a cosmetic physician and talk about, okay, I'm pretty happy, I'll stay on my program, but how do I lose weight locally? How do I shrink fat off my tummy or my pot? And during that first opening segment, we talked about some of those options. It doesn't always have to be liposuction. That's often your best option. If you have loose skin and fat, it could be a tummy tuck. But nowadays, we have tremendous technologies like cool sculpting and sculpture, and this new M-Sculpt I was talking about, to kill fat safely with no surgery from the outside in, and target an inch or two reduction. You don't want to be unrealistic. It's not lipo, but it is dead fat, and you can target it locally without having to change any diet or exercise routine or go into some crazy amount of carbohydrate or calorie restriction.
So you can so is it a surgery that you're talking about?
No, I'm talking about non-surgical. Most patients shy away from surgery, but if you ask me, Dr. Mulholland, what's the best way to lose my pot? It's always going to be liposuction or a tummy tuck. But if you say to me, do you have a non-surgical way where I can kill fat permanently and make a contour improvement with no risk or very little risk? Yeah, we have a lot of those things. Over the last 7 or 8 years, we've got technologies like cool sculpting, sculpture, UltraShape, the Vanquish, M-Sculpt, this new one. So we can kill fat from the outside in non-surgically. It may not be the big 4 or 5 inch reduction you want. If you really want a massive reduction of localized fat under local anesthesia, you have to still do what's a modern version of liposuction. And so you have 2 options, a surgical or a non-surgical option.
What would the downtime be for the non-surgical procedures?
The nice thing about non-surgical, like for problem areas like Maria complains about the pot, you could walk into a center, do your consultation, do your initial treatment, and go right back to work.
Oh, wow.
There is no downtime.
You don't have to wear like a girdle or anything like that?
No, I mean, you may elect to squeeze into one of those, but I don't prescribe them or I'd have no patients. And so, yeah, tummy support is elective. You just have to get under the technology, whatever it might be. You're generally going to be 25 to 45 minutes, depending if you're cooling, heating, ultrasounding, or EMS or muscling. And you go right back to your activities and you do a series of treatments. It's going to be between 2 and 4, depending on the technologies. And you can get a significant and noticeable reduction of fat. Okay, it's not lipo, but it's sometimes pretty darn good.
416-872-1010. Here is Derek. Welcome to the show, Derek.
Hi there. How you doing?
Good, thank you. Go ahead with your question.
Sure. I'm a 49-year-old male, and I'm in good shape. But I have these little lines that are forming in front of my ear on both sides, and I find that's like a tail sign that I'm getting older. So is there anything that can be done non-surgically for that?
Yeah. So, Derek, you're 49. You sound like you're probably a big smiley guy.
Somewhat, I suppose.
Full dentate smile. You show your teeth when you smile. You're not like a smirker.
Yeah.
Okay. And so when you smile, it crinkles a little bit. But what you're talking about is those very annoying post-sideburn in front of your ear wrinkles. It looks like kind of grandpa skin, but you're
Yeah,
a
that's
young
right.
guy and you don't want to have that grandpa skin. It's not uncommon. And so I'll have a number of guys. If you were a little older, I'd say, well, do a little mini guy lift. We lift the skin up and hide it in your ear, but that takes surgery. Your best option, can I ask if you are light-skinned or darker skin kind of ethnicity?
Caucasian, Mediterranean skin.
Okay, so in general, we have some fractional, non-surgical fractional techniques that use either radio frequency energy or a laser, a fractional laser, or a radio frequency device that can usually take, those are fairly fine lines there, not like your smile lines, and we can basically do a selective thermal injury. Well, let's call it what it is, a selective burn. And we can burn the wrinkles down. You have to take 7 to 10 days off like you have a bad sunburn. But if they're fine lines and you have fairly light skin, you can anticipate 95% reduction of those lines.
Wow.
Of course, you can never smile again, Derek, but that's beside the matter.
Okay, I like that. Thank you.
Okay?
All right, Derek. Thanks a lot for the call. I think you were kidding about the last part.
No, you can smile, but just you can't see all your teeth. Full dentate smilers look like Tom Cruise looks great at this age.
Yeah.
Because
he
of all the
doesn't smile.
surgery, because all the surgeries had.
Yeah.
But let's say if you watch Tom Cruise and that full dentate smile, you end up with all these lines and wrinkles that go all the way back to your ear. So it looks great, those big white smiles when you're young, but you pay the price for all that happiness.
He looks weird good.
Well, he's always looked a bit weird good, you know. He's always had that huge, full dentate, engaging smile going like right back to Jerry Maguire and those early shows when he was just in his early 20s. And he's got a lot of charisma. He really captures the screen. I've had the chance to see him live when he's not that far away and not on screen. You would think, man, that's not Tom Cruise. He's got have a face double. Some people just light up a camera, and he's one of them.
He is, because he always looks amazing on camera, but then if you see just pictures of him, it's not the same.
Right. No, he definitely, he's got that sort of, that George Costanza look about him when he's not on air. He's not unassuming, but wow, he's got that full dentate smile. But my point is, his cheeks, if he's not doing some kind of non-invasive laser,
They would be
plumper,
really wrinkled.
totally. He looked like Robert Redford by now in some Sundance commercial.
Okay. All
Some
right.
old guy with a gun.
We've got a couple callers on the line. Please hang on if you have time, because we have to take a break, but this is like great information, and I love learning about this stuff too. Dr. Mulholland is here. Normally, I think we would have to pay for a consultation, but tonight you're getting it for free. 416-872-1010. He is the founder of Spa Medica, one of Canada's top cosmetic plastic surgeons. Give us a call now. You're listening to The Night Side. Great to have you along on a Thursday evening. It is a fun night and a busy night. Dr. Stephen Mulholland is here, founder of Spa Medica, one of Canada's top cosmetic plastic surgeons. I know a lot of you have questions, and great that you're calling in at 416-872-1010. We will get to all of your questions, and I'm curious to hear, because it's always interesting the kinds of procedures people are interested in having done, and downtime is a big one, because a lot of times, is it fair to say people will come to get things done? They don't really want everyone knowing that they've had something done.
Yeah, one of the management discussions is who's going to help care for you after when you go home, either that day or the next day. And then what is your transition plan back into your normal life, principally the workplace? We're much more open about cosmetic surgery, and we talk about it, and everyone else has had it, but of course no one's had it done. And so it's still not that open where we say, what do you think of my facelift scars? Those look great. Or you lift up your shirt and say, what do you think of my breast augment? That's standard, not coffee time chatter around the cooler chat. So people have to have a plan on what to say at work. And general have a transition plan on, I needed to have, some abdominal surgery. Keep it general. Or if you had facial surgery, I had some gum surgery, so I'm a bit swollen. Oh, you should have seen me last week. Nobody likes dentists, really. So always blame it on the dentist wherever possible.
All right, 416-872-1010. Kira, thanks for holding, and go ahead with your question.
Hi there. So I had a breast augmentation about a year and a half ago, and one of my scars has a small bump on it, almost like a skin tag. So I was wondering, one, how do I get rid of that? And two, is that something that I have to pay for, or does my surgeon cover it?
Oh, that's a good question.
Yeah, that's a great question, Kira. And this was not a molar skin tag that was there before?
No.
This was new. And it was an under-the-breast incision approach, not areolar or armpit. It was under the breast?
Yep, under the breast.
And so what happened during the closure, in all probability, there was a little bit of a proud flesh or a slightly uneven incision line. or you could have had a little bit of flesh that got buried under the skin and you got an inclusion cyst. Regardless, it's likely benign, likely nothing to worry about. And most surgeons, if you call the office, it's in their incision line, we take responsibility, we feel badly. A little local anesthetic, a little nip with some scissors, and maybe a little electric cautery or a one stitch, and it'll be gone.
So
Okay,
have you talked to the surgeon about it?
No, I haven't called yet. I keep putting it off, but it's been a year and a half, so I think I should call him.
Now, it is under the incision. It's hidden under your breast. The obvious question is, when do you ever see it, or whoever sees it?
That's the thing. That's why I've been putting it off, because you don't even see it when I'm wearing a bikini.
Right.
But it's something that I know it's there, and it does bother me.
Yeah, it bugs you. You paid for perfection, and you have. If you have this, if you're still dating, it's kind of creepy if your date's playing with this little skin tag thing. And so I think that in the interest of perfection, most plastic surgeons in the city are perfectionists. That's why we go into it, and they'd be quite bothered that you have this, and it would cost you nothing. It would likely be part of the post-op care. Local anesthesia, literally 15 minutes, nip it off, just like a skin tag you might have in your armpit or your groin, and it's gone.
Oh, perfect. Thank you so much.
All right, okay. Kira, thanks a lot for the call. 416-872-1010. You gave me a visual there that I just don't want. Marlene.
Well, it is radio.
Yes, of course. Marlene is next. Hi, Marlene.
Hi, good evening.
Hi, go ahead with your question.
So I've been dealing with what I've been told is melasma for many years, and I've tried a number of products and nothing's worked. And I'm a light-skinned black woman, and I know laser is not necessarily the best treatment for me. And I was just wondering what I could do to get rid of it, because even going out for a walk or out on my front porch, it's just a struggle. I have to slap on a lot of makeup to cover, which doesn't always do such a great job.
What exactly is melasma?
Marlene, thanks for calling in. How old are you? How young are you, I should say?
I'm 56.
Okay, so
I've been dealing with this for over 20 years.
Yeah, and practicing here in Toronto for the last quarter century, I have to say, I go to other cities to lecture and talk to doctors, and they might have in the U.S. a few Hispanic patients, but no city I know of is as multicultural as we have. We have Caribbean Canadian like yourself. We have Guyanese. We have lots of Southeast Indian, Asian patients, and melasma is a big issue that we treat at Spa Medica. And so, melasma is a condition of abnormal production of pigment. It's a hereditary, hormonal, and an environmental problem. So you probably have a mom or grandma that passed on the tendency for your cells to lay down that melanin. It's often geographic, irregular brown spots, not small but large ones, cheek, forehead, under eye, and they can be very dark and hard to cover. It can be hormonally triggered, so as you enter menopause, it gets worse. After you've had a couple of kids, it comes on, it doesn't come back, and never goes away. You can go out and get just a little bit of sun, and it darkens, and it never lightens again. And so melasma is a bit of a curse. Whereas the Celtic curse tends to be red rosacea kind of faces. The Mediterranean, Asian, Caribbean curse is melasma. Now, fortunately, even for a light-skinned Caribbean gal like yourself, we have some good options. First of all, you need a medical prescriptive. You can try hydroquinones and bleaching agents, but you've got to get
I've tried all of those.
Okay, so it's not going to be a cure. It's going to be the first phase of stunning your melanocytes into the cells that make pigment into like a coma. It won't go away, but they kind of quiet down. And that allows a center, a cosmetic dermatologist, myself, other centers that have something called a picosecond pulse duration laser. These are very new. It's the last 4 or 5 years. The picosecond is such a short pulse duration, it doesn't generate much heat. It shatters the pigment, even in dark-skinned patients, into tiny bite-sized morsels so your immune system can take it away. So in general, doing a picofacial with a picosecond laser, there's maybe 15 of them in the city of Toronto, which is a good number of them, you can get about a 70% reduction in your melasma which is better than we've ever been able to do. And you need to stay on that bleaching cream during the entire process. I'm talking a medical prescriptive, 8% hydroquinone, 0.5% retinoic acid, a little kojic acid, topically in your skin. And you can control it. It won't be cured. And you have to look at melasma as if you have diabetes of your skin. You can never get rid of diabetes. You
It's managing it.
It's managing it. But you do need a picosecond laser. It's reasonably affordable. When I say reasonable, obviously it's more expensive than anybody wants. But generally for $2,000, $2,500, you can have a 6 to 8 month program that gets 75% reduction in your melasma, and then a simple 3-time-a-year maintenance program to look after it. But you need to avoid sun exposure wherever possible. And just avoid those curling iron burns or thermal stimulations that sometimes lead to a brown spot that never goes away.
You know what's interesting about that? Because for some people, they would hear that and say, $2,000. And that may not be manageable every single year, but if you've got a big event coming up and this is really important to you, or you could do it fewer times and not have the same level. But for people who have that, it sounds like she's always being careful, because I guess it just continues.
Yeah, it is a progressive skin disorder that is relentless and then amplified by UV sun exposure and postmenopausal hormonal environments. And so it is one single program. Once you've got that control, it's really only coming in 2 or 3 times a year, so it's quite affordable to maintain.
416-872-1010. Text us at 71010. Everybody who is on hold, we are going to get right back to your calls just as soon as the night side continues. Dr. Stephen Mulholland is here, founder of Spa Medica. He is one of Canada's top cosmetic surgeons, and he will answer all of your questions. You're listening to The Night Side. Great to have you along. Dr. Stephen Mulholland is here, and we are taking your calls on any questions regarding invasive, non-invasive procedures. He is the founder of Spa Medica, one of Canada's top cosmetic surgeons. Let's go back to the phones, 416-872-1010. Shirley, welcome to the show. Go ahead.
Yes, I have a droopy eyelid. What is the procedure for righting that?
And it's just one of your eyes that's droopy?
Just one.
Yeah, and it's been there your whole adult life, or gotten worse as you've gotten older?
No, and I'm getting older all the time.
Yeah, okay. So what you have is what's called ptosis, P-T-O-S-I-S, if you're going to Google it. Basically, there's a special muscle in the crease of your upper lid. As you get older, sometimes it separates from its job, which is holding the lid up, and you get what's called a senile, not that you're senile, it's just the medical term we use for it, ptosis or droop. And so it needs a little procedure called a ptosis repair. Now, in the old days, like when I trained in the 80s, if it was encroaching on 25% of your visual field, OHIP would cover it. Good luck getting that nowadays. And so you would start by getting referral to a plastic surgeon or an oculoplastic surgeon. These are ophthalmologists that specialize in this little lid tuck, and it's a ptosis repair. They actually reinsert the muscle into the crease and tighten up the muscle. So they try to balance, it's almost like a blind is coming down in your eyelid, is closing like a blind on a window.
Right.
And they try and right the blinds, get the Venetians right on both sides. And they would leave your normal eye alone and try and match the droopy eye to the other side. It's done under local anesthesia. It takes about an hour. Very successful. It's probably nowadays, the way OHIP's gone, it's probably going to cost you about $2,500 and up, but generally a good investment because it lasts forever.
Well, I was told I'm a senior. I was told it was covered.
Well, if you'd have to get an ophthalmologist then that writes a letter to OHIP and sends your visual field, and sometimes they do cover it. It's by my experience, it's more and more difficult to get covered. They're not in the business of funding more surgeries. They're trying to deny us surgery. So I think if it's encroaching on your visual field, it should be covered, and just get an ophthalmologist that gets behind that concept and submits a letter on your behalf.
Shirley, thanks a lot for the call. Myrna is next. Hi, Myrna.
Hi.
Go ahead with your question.
I have 2 questions. One of them, first of all, I'm 48, and my skin looks pretty good. I have no wrinkles whatsoever. I'm interested in the collagen induction therapy using a derma roller. I want to know if that actually helps to produce more collagen in the skin, number one. Number 2, even though I have no wrinkles, my face lost some of the fat layers, and it does look like a little bit sagging, like not plump, and obviously I'm not young, but I want to know if there's anything that can be done to keep that plumper look, or, is there any procedures?
Yeah, those are two good questions, Myrna, and they're two separate topics. Let's start first with your college induction therapy. Basically, there are a ton of little microneedling devices available now, with or without radiofrequency energy, and they penetrate into the superficial layer of your skin, and they create a little micro wound. And any micro wound that's not excessive is going to result in new collagen and ground substance production. So microneedling is one of the entry levels into an aesthetic treatment, microdermabrasion, microneedling. Then you can add growth factors like something called PRP, where we draw a little bit of your blood, we spin it down, and we have growth factors and stem cells, and we can then put it on your skin through those little microneedling injuries to induce even more collagen and elastin. However, your skin sounds very smooth, just deflated. So microneedling is not a good option for you because, as you said, your texture is pretty good. You don't have many wrinkles. You've lost volume. Do you have normal menstrual cycles still?
I do.
Okay, do you work out a lot? Did you get fit and lose some weight and you're happy with your body, but your face didn't follow that same plan?
Yeah, exactly.
So that's what happens. I see a lot. I call it the worker outer's face or the jogger's face. They look great, man. Their biceps and they're just ripped on their body. They look awesome, but their face looks quite deflated, and you lose that facial. We call it the fullness of youth for a reason. Those nice full cheeks, that oval shape, and then you get these hollow temples, hollowing under your eyes. The cheeks deflate. It sags a bit, and you look a bit cadaveric. So here you are, like 48, looking hot from the collarbone down, but you need candle lights and dimmers for the rest. And so, thank goodness for fillers. With fillers saves the day for worker outers. So you can work out to your heart's content and do a little bit of Juvederm and volume maybe once a year to keep the volume up. You don't want to look like filler face, those giant overly filled faces, but just enough volume to bring back the volume you had so that you can rock the hot bod from the workouts, but your face doesn't look like deflated and old and saggy and cadaveric. So that's a very, very common problem. And so the solution is either put on some weight. And it's been an old adage that goes back way, way back that you sometimes have to sacrifice your butt for your face.
Yeah, that's right.
But if you want the hot butt, your face takes the heat. And then nowadays we got volume shapers like Juvederm and Restylane, and we can just once a year add a little plumping, and it allows you to preserve what you got. Now, you could take fat from residual fat pockets, spin it down and inject fat, and that may give you a longer term result. That's a little more expensive and a little less guaranteed to give you how much you want, where you want, but injecting some volume that gives you back that fullness of youth without looking overdone is a secret to being an exerciser as you're approaching that perimenopausal age.
416-872-1010. Roseanne, welcome to the show.
Hi. I'll keep my question really quick. About 7 years ago, I had a very extensive circumferential body lift. The procedure itself was, I believe, almost 7 hours. And what the remainder, they took 17 pounds of skin off.
Wow.
No fat from my abdomen. But what I was left with was where I had a small in my back. It's now a bump in my back. And it's kind of in two parts. So I have like an extended line along my spine, and two very firm kind of pieces that no matter how much I try and lose the extra fat, it's not going away. And I didn't know if that scar tissue could potentially be surgically removed or maybe liposuction or whatever. I was looking at cool sculpting, or if there's some way I can get rid of it. And I also wondered if it's normal for areas where you've had liposuction, say along the outer thigh, where they did a little bit of sculpting on my thighs. It's numb, and the feeling has never come back. Is that normal as well?
Well, those are good questions. First of all, congratulations on losing enough weight that allowed you to do that body lift. So that's a big commitment through gastric manipulation or bypassing or just good old-fashioned fortitude or a combination of everything. And then, body lifting is a very specialized area of plastic surgery. There's about 3 guys in the city that do it really well. Dr. Bray, Dr. Abdafar, Dr. Dupre. Those are probably the busiest body lifters. And almost certainly, I'm not a body lifting guy. I do neck lifts on people who've lost a lot of weight, but not the body work. I leave that to guys like Dr. Bray. Now, once you've done a body lift, I do know that all 3 of them would say there's almost 100% chance we're going to come back and we're going to have to work with the fabric a little bit. Because when you've lost a lot of weight like that, your collagen content, your elasticity is not quite the same. And so once things have settled and Isaac Newton has weighed in on where this gravity is going to take the soft tissue, there's often little touch-ups that are required. It sounds like you may have a bit of a dog ear, which is a little extra fabric when you're, taking the dark out on a dress. Sometimes you have a little dog ear, a little standing cone of flesh that may have a little fat in it, and sometimes you can do a little bit of enhancement lipo and it'll sit flat. Sometimes you have to do a little bit of lipo and cut out the tissue. But what I would do is I'd go back to your physician if you still have a good relationship, if you feel confident with them. If not, seek out one of the other 2 or 3 guys I just mentioned and say, look, I was pretty happy with the overall body lift front and back, but I got some issues around the scar. What can I do now? And usually it's a local anesthetic, hour-and-a-half procedure max.
It's a significant space, though. It's like 4 inches by about 10 inches, and it's hard.
Okay,
like it's firm.
And it may be you have some fibrous scar tissue there. Okay. And again, usually it can be dealt with. If it's just enough to be protuberant and your scars have healed well without keloids or hypertrophic scars, it would be very unusual not to be able to deal with a postoperative contour. We're on the air, so it's hard to know exactly what you're talking about. But I would just say that almost, let's say if I was doing a neck lift on you and you'd lost a lot of weight, I would say there's 2 surgeries we're going to have, ma'am. The first one and the second one, and pre-plan about a year later just to deal with some of the issues around elasticity and tone. You had a big surgery. You're probably super happy you did it. You just want to do a little renovation on the scar, basically.
So we are way out of time, but there is a caller. I'm not going to have time to take the call, but maybe if Susan can listen. She had to have some surgeries that ended up developing a mild staph infection. Now she wants to have a surgery to get rid of bags under her eyes. Doctor says no. Is there any way it could be safe?
Well, she probably had some methicillin-resistant staph, and we've all heard this in the back of our mind on the news, the MRSA, very common in teaching hospitals with multiple resistant organisms, is carried in the nose. And all I would say is as long as she was no longer a MRSA carrier, and she was treated for her MRSA, and you do a nasal swab, and it's no longer there, then I will offer cosmetic surgery to MRSA patients who've been proven to no longer be carriers. Because if you're not a carrier, you're not exposed to these resistant bacteria, then you are no higher risk than anyone else in the population.
All right. We couldn't get to all of your calls this time, but thank you so much. And Dr. Stephen Mulholland will be back probably in about 4 weeks' time, depending on his busy schedule. Thank you very much for this.
Thanks as always, Barb.
And people can find you at spamedica.com?
They can, and actually in the building.
And in the building, they can find you, not just on the website, but I know you do podcasts and videos.
So we do a lot of stuff. And if they want to see what's cool and what's new, I'm almost every second weekend in the U.S., some U.S. city, teaching lasers, energy-based devices, always non-invasive of what's new, what's happening, what's available.
Very cool. Thank you very much, Dr. Stephen Mulholland. You are listening to The Night Side.